A beautiful day mga ka-CSA. Welcome to Certified Skin Authority. I'm Dr. Contessa, your host, giving you updates on the science of skincare, anti-aging medicine, laser technology, and aesthetic dermatology. Pag-usapan naman natin ngayon ang patungkol sa drooping or sagging eyelids or hooded eyes. So what are sagging eyelids? What are hooded eyes? Ano po ba ang nagkukos ng mga ito? And ano ang epekto sa ating mga looks and sa ating daily living? Ano po ang treatment na maaaring gawin ng CSA upang solusyonan ang ganitong eye concern? And makakasama rin po natin ang aming special guest na isang medical student upang pag-usapan o talakayin ang mga iba't ibang eye concerns katulad ng eye bags, dark circles, mga lines and wrinkles around the eyes. And amin din pong ipapakita sa inyo ang actual demonstration ng aming treatment for brow lifting or eyelid lifting. So amin pong tatalakayin yan sa pagbabalik ng Certified Skin Authority. Certified Skin Authority.
So this is now ice compress on the injected area.
20 to 30 minutes and also to do.
Okay, mainit na ba siya? Ating
Saan titingin? Dito? Dito? Welcome back to our practice bahay. Ngayon pong araw na skin analysis po natin siya, and the treatment that we're going to do is also good for her. Parang best. You wanted to enhance in a way na gusto mo mag-lift siya, mag-angat. Right? And then also sa nasal. So we have actually applied na yung namin cream on this side. Dito lang sa area
corner of the mouth.
And then dito po, BSS. Sige, kindly clench. Okay.
Hi, I'm Vanessa at bilang isang medical student, lagi kaming may problema sa quizzes, exams, projects, and reportings. So every day, we are bombarded with stress and then it will accumulate. Magkakaroon kami ng eye bags na yun ang lagi talaga namin pinoproblema. So I'm here today with Dr. Tessa to learn more about eye bags and how to prevent them. Also, not only eye bags, but also about puffy eyes, hooded eyes, droopy eyelids, and a lot others. We're going to know more about their causes, home remedies, treatments, surgical treatment, at pag-uusapan natin ang kanyang bagong treatment, ang Ultherapy machine. So, abangan natin yan, guys.
And we're back mga ka-CSA. Atin pong pinag-uusapan ang patungkol sa mga eye concerns. And meron po tayong kasama ngayon na isang registered nurse and a first-year medical student. Mga ka-CSA, let us welcome Miss Vanessa de la Rosa.
Hi, Doc!
Hi,
So
Vanessa.
excited po ako dito.
Yay! Thank you for gracing our episode for today.
Thank you po, Doc, for welcoming me here.
Yes.
Kahit na busy po yung schedule nyo ngayon.
Right. And being a nurse and at the same time, a medical student, what made you pursue medicine?
Promise ko po talaga kasi ito sa lolo ko po na wala na ngayon.
Okay. Oo.
Pero, ayun, continuing the dream para po
Yes.
sa kanya, for family, pati para na rin makatulong sa ating mga kababayan.
True. That's true mga ka-CSA. Being a medical student, you have that heart to serve our fellow men, di ba? Yun
Opo.
naman lagi ang sinasabi natin. And then, being a medical student, of course, you have ideas on medical aspects, medical treatments, and of course, nakaka-experience ka rin ng mga eye problems, di ba?
Madalas po, Doc.
Madalas. Kasi mga medicine students po, mga ka-CSA, lagi daw kulang ng tulog dahil sa pag-aaral, di ba? Very much focused.
Opo, Doc. First year pa lang po.
Imagine,
bombarded na.
mga ka-CSA, first year pa lang po, it's always that aspect of always reading your textbooks, your medical books. But it's an advantage for you kasi nurse ka na eh. So you have an idea on these ones. Kaya pag nag-aaral ka na, hindi na siguro masyadong puyatan.
Opo, pero nandiyan pa rin po yung stress.
Oo. Ano ba yung usual hours of sleep ng isang medical student?
Wow, nag-vary po kasi kami eh. Yung mga sobrang talino po kasi, natutulog
Walang
sila
effort.
eh.
Okay, wala na silang masyadong
Balita ko kasi 5
extra.
hours sila.
5 hours of sleep.
Sila, pero
Yeah.
kami siguro mga 3 hours to 4 per day.
Naku, sleep deprived ang mga med students. Well, actually po, I'm one of her professors in the Department of Biochemistry. But Vanessa is one of our very good students also. Pero you don't show any signs naman ng lack of sleep, Van. Ano bang secret? Diba?
Nag-aaral.
Nag-aaral, okay.
Siguro researching on home remedies na rin po for
Yes.
prevention.
So you have tried some home remedies to control yung, kasi the issues nga rito, yung mga eye bag, puffiness, diba? Or dark circles. Yan yung mga issues eh.
Opo.
At your age, kasi how young are you, Van?
22 years old po.
22 po ang ating kasamang host. So, she doesn't experience yet yung mga problem ng mga older generation na may nagsasag na eyelids or yung wala na yung elasticity. So, in your part naman, it's more of lang yung lifestyle, yung lack of sleep, or genetic factors may even play a role eh. Kasi some people have already this, like yung mom or dad, you can see their eyes. Yung iba naman, yung shape, di ba? Or hooded na yung eyes, or yung talagang may eye bag talaga. So, pwede
Opo.
kasing inherited ang mga ganitong eye appearances.
Opo.
Pero going back to dun sa topic natin, Vanessa, kasi we're talking about sagging eyelids, drooping eyelids. Ano bang ideas mo dito?
Kasi ang ideas ko po dyan, personally, stress lang talaga. Pati diet.
Yes, okay.
Diet. Na kapag sobrang, siguro overweight lang, kahit na konting overweight, yung excess fat deposits, yung sobrang taba, napupunta rin sa mata.
Yes.
Dito sa balat ng mata. Kaya bumababa yung skin.
Yes, that's one factor, okay. Pag overweight ang isang tao or high body mass index, mataas ang fat percentage, some of those fats can accumulate around the eye area or yung fat pads like infraorbital or below the eyes, okay? Pwede kasing may mga fat pads doon. Yung iba naman, it's periorbital fat pads, okay? So, one factor, yung being overweight. But when you say kasi sagging eyelids, pag sinabi mong sagging, sagginess, yun yung wala na yung firmness or tightness of the skin, hindi na siya ganun ka-lifted or ka-tight or ka-firm. Nagsasag siya, napaka-loose. Take note kasi ang skin around the eye is very, tawag dito, it is thin, tsaka very delicate yung skin around the eye area. Pag sinabi mong sagging eyelids, yun yung excess skin, na wala na yung mga natural fibers like collagen, elastin, nawawala na. So wala na yung mga protein fibers that hold your skin, na naglilip sa skin. Kaya yung iba, nakikita mo na nagdudroop or yung parang hooded na rin yung eyes, natatakpan na yung upper portion ng mata.
Okay.
So yun yung mga sagginess on the upper eyelid area.
Opo.
Kasi you were mentioning yung being overweight, yun naman excess fat pads around the eye area. So ibang concern naman yung sagging eyelids. That's a different thing. So yun, nawala na yung mga protein fibers that hold your skin, making your skin tight, firm. So hindi siya naglalawlaw on the upper eyelid area. At saka yung pull of gravity. And ang cause kasi ng sagging eyelids, yung aging process.
Aging
Yes.
process.
Yes. So ang aging process kasi, yun yung nawawala na yung mga collagen mo, elastin fibers mo, so nagsasag na rin yung skin. So yun yung sagging or drooping eyelids. So, may iba na naman tayong aspetong pwedeng pag-usapan kasi. Napakaraming issues around the eye area, Vanessa. Sa mga ka-CSA, itutuloy po natin ang ating talakayan sa pagbabalik ng Certified Skin Authority. And we're back again mga ka-CSA. Atin pa rin pinag-uusapan ang patungkol sa sagging eyelids or droopy or hooded eyes. So Vanessa, kanina we've been mentioning about the causes nung pagkakaroon ng mga droopy eyelids. eyelids. So, kanina, you were saying possible yung being overweight, or possible yung sa diet na sinasabi mo, baka sa sobrang alat na kinakain, nagkakaroon ng periorbital edema, or sabi ko naman, yung aging process, okay. Other factors na pwede nating isipin, bakit yung iba droopy yung eyes nila, or hooded ang eyes nila, race, or yung mga Asian ka ba, or European descent ka ba, yan. Kasi napapansin mo, yung mga Koreans or Chinese, yung shape ng eyes nila, right?
Hooded talaga, na
They're
bumibili
hooded.
raw po sila ng
Yes.
pantuklap ng eyelids.
Yeah. Sa Koreans,
Apo.
meron silang ganon, di ba? So, napapansin mo yung upper eyelid skin nila. Actually, wala nga sila nung natural crease na tayong mga Pinoy, meron tayong natural crease eh. I think they even buy that thing, yung sticker ba yun?
Apo.
Para lang magkaroon ng parang natural line or crease sa ating upper eyelid. So dito, so yung race pala is one factor. So genetics, races, or gender, being a male or a female. Pag female kasi, di ba, more of fat percentage ang female. So parang ang mga females, more of naghuhooded ang eyes.
Opo.
Right? So those are factors pala sa pagkakaroon ng hooded eyes or yung nagdudrop or nagsasag. Aside from yung pag-age or pagtanda. Now, medically speaking, we have this condition called ptosis.
Opo.
So, what is your idea on ptosis?
Ptosis is a medical condition that could be alarming na hindi po to maganda, na kailangan talaga po magpatingin sa doktor.
Yes.
Kasi pwedeng isang mata lang or pwedeng dalawang mata, bigla na lang magdodroop.
Yeah.
Tapos, isa itong kondisyon na naapektuhan ng ating utak.
So, ptosis is a medical term for drooping eyelids. So, yun naman, may medical condition or some form of nerve damage, mga ka-CSA. So, yun po sa medical aspect. And, going back sa aesthetic aspect naman, kasi people are so conscious sa eye area. Yan ang tinitignan lagi sa atin ng ating mga kausap. Di ba, Vanessa? Like right now, I'm looking at your eye, you're looking at my eyes. Sabi nga nila, ano ba yung kasabihan? The eyes are
The windows to one's soul na
Right.
nakikilala mo na yung buong katauhan nila sa mata pa lang.
At sa mata pa lang, nakikita mo na kung anong edad ng kausap mo, di ba? Or, alam mo kung kulang siya sa tulog, alam mo kung masyado siyang pagod, stressed, fatigue. So those are also factors. Yung being overstressed, overworked, fatigue, di ba?
Pareho po tayo.
Okay. So yung lack of sleep, yan. Yung people will think na, oh, parang yung eyes mo, pagod na pagod ka, you're so tired, you're so fatigued. And of course, tayo naman, we would also want to look always yung well-rested, yung hindi laging fatigue look, di ba? Or yung parang fresh-looking eyes. Yan ang lagi natin gusto.
Opo.
Kasi it's so, what do you call it, so pleasing to the eyes din na nakikita ka, oy, yung mga mata mo, they're so bright and shining, well-rested, fresh-looking, and young-looking. Diba? Kaya nga dito sa CSA, atin din tatalakayin, ano ba yung pwede nating gawin para ma-prevent natin yung signs of aging around the eyes. Kasi dyan, yung iba, nakikita mo na may mga fine lines na, may mga wrinkles na dito sa side ng eye, o kaya yung sunken eye. Yan, ako, lahi namin, yung sunken eye area. Or yung mga Indians, you notice them, yung they
black
have
circles.
dito. At yon, yung dark circles, di ba? Raccoon's eye or panda's eye. Med students are always like that. I always see. Medyo well-rested ang ating Vanessa eh. Hindi masyadong nangangailangan ng effort sa pag-aaral. Isa kasi siya sa aming top students, di ba? So, yun.
Preventive measures lang.
Meron siyang preventive measures. And here at CSA, we will be talking about those preventive measures. We will also show you the actual demonstration ng ano ba yung pwede natin gawin ng mga non-surgical, okay, before we proceed to a surgical technique. By the way, kasi may mga indications kung surgical ba or non-surgical. That will depend on the severity ng sagginess ng upper eyelid. You've noticed, di ba, yung meron na yung mga iba, napaka-droop na nako-cover na yung kanilang upper eye or yung pupils ng eye.
Opo, nakakasagabal na raw po yun sa mga activities nila.
Yes.
Kaya,
So yun yung mga severe type, yung talagang natatakpan na yung mata and obstructed na yung vision. So there's a visual obstruction. That's severe. We usually recommend surgery for that. The surgical, it is so-called blepharoplasty. Now for those with a mild to moderate problem, yung hindi pa masyadong ganun ka-droopy or may signs na nakikita na natin ng droopiness, we can do non-surgical technique. And we may be offering a combination therapy for that. It could be in a form of a machine, in a form of some non-invasive or minimally invasive techniques. So atin pong talakayan yan sa pagbabalik ng Certified Skin Authority. And we're back mga ka-CSA. We are now on the part of showing you the treatment on sagging eyelids. And of course, kasama pa rin natin si Miss Vanessa and also Jaja, our therapist here. And we have also our model, Miss Susan. She's 52 years old. And the concern is the sagginess on the upper eyelid area. So, itong part na to, treatment, we will be using the so-called Ultherapy. Okay. Have you heard of the Ultherapy, Vanessa?
not yet.
Not yet. So this is again a non-invasive, okay, non-invasive procedure to treat the eyebrow area plus the saggy eyelids. Yan. So isang procedure para po mag-tighten yung skin, mag-firm yung skin dito sa my forehead area. So mapupull niya yung skin. Okay. Kasi like si Ma'am Susan, concern na nga niya yung nagdo-droop, nagsasag, right? Pero ma'am, hindi pa ba affected yung iyong vision with that sagginess? Hindi pa po. Hindi pa po. Pero looking at the history po, before kasi si Ma'am Susan already had a surgery, the so-called blepharoplasty sa upper eyelid area. Kailan po yun, Ma'am Susan?
Itong last 2010.
So, it was about like 5 years ago, right? So, because yung problem niya was yung very saggy. Talaga pong mababa yung dito sa upper eyelid niyo po. So, medyo natatakpan na talaga pati yung vision mo. Yung paningin mo, apektado na po. Okay. So, you had the surgery. So, that was about 5 years na po. Pero sa ngayon, napapansin na rin natin, nagsisimula na naman na mag-droop yung upper eyelid area. Right?
Yes.
O yun, ano po yung option kung hindi na tayo magsusurgery? Kung ayaw na ng operasyon, we can make use of these non-invasive procedures na, which is the ultrasound therapy. Yun, it makes use of the ultrasound technology, mga sound waves. And these sound waves are micro-focused sound waves para matarget yung inner layer nung sa skin. Actually, it's beneath the skin layer yung tinatawag na fascial plane. So, doon siya po nagtatarget. Plus, sa inside, meron kang collagen formation. That's the beautiful thing with this Ultherapy, Ma'am Susan. So, hindi mo na kailangan ng longer downtime kasi pag di ba nung na-surgery ka, you had to rest, you had a longer recovery time kasi may, may incision, may cut, may suture, di ba? So, you had to rest for a longer time tapos hindi ka pa pinag-work agad. But with this one, you can do the procedure right now. Pwede siyang lunchtime treatment or afternoon treatment na walang longer recovery, rest time, or downtime.
Wala naman pong side effects.
Okay. This one naman, since it is non-invasive, non-surgical, okay? So, ang ina-expect lang natin after the treatment, mamula-mula lang yung skin. So, tsaka slight pa swelling lang sa skin. That's it. Right? Since non-surgical, very safe and very effective. Plus, it is FDA approved. So, what we're going to do is a so-called brow lifting, upper eyelid lifting. Before we do the procedure, we have applied this. Ano ba itong topical cream na to, ma'am? So, this is the topical lidocaine na in-apply natin on the area para po walang maramdamang discomfort si ma'am Susan. Okay, so our therapist will be removing na yung ating numbing cream. It's the numbing cream. We left it for about an hour para po talagang manhid yung skin. Are you excited, Ma'am Susan?
Of course.
Of course. So this is just a prevention po doon sa tuloy. Siyempre naman, ma'am, di ba? Yung signs of aging is a continuous process. Kahit nagpa-surgery ka na, meron pa ring tendency na nagsasag yung skin.
Opo.
So, it's also a very good treatment for those who did the procedure na 5 years ago, 6 years ago. So, pwede po silang mag-non-surgical. So, prevention na lang, Ma'am Susan. Right. So, dito lang po tayo magpo-flash ng ultrasound therapy. And then, actually looking at Ma'am Susan, so aside from yung mga concern na natin dito sa saggy eyelids, so our therapist can start with the treatment. We'll be using ultrasonic gel. Manonotice mo rin yung puffiness, yung eye bag area, no? Si Ma'am yata, medyo ang lifestyle is stressful din, di ba? So, yan, factors of puyat, yon. So, meron na rin tayong mga lines, fine lines, okay? Kung tatargetin mo kasi dito, you can do mga injectables also. So, here at CSA, we offer also injectable treatments, yung ating injection ng Botox, yung ating mga dermal fillers, to also complement or to also treat the other concerns sa eye area ni ma'am. Pwede siyang mag-filler dito sa tear trough. Pwede natin i-botox yung below the eye area. Pwede rin po tayo mag-botox sa crow's feet area para matarget din yan. Diba? Para naman ma-rejuvenate ang eye area ni Ma'am Susan. So, we need a gel. Okay, mga ka-CSA. Ito po yung ating Ultherapy for brow lifting and upper eyelid lifting. So, it can be a prevention for the sagginess on this part. So, parang yun, no, napapansin nyo, itong excess skin. Napaka-lax. Loose na siya, right? So, you wanted to tighten and firm this top layer. So, you're able to remove yung mga excess skin. You can lift this, you can pull this. So, meron kang vector for pull ng skin upwards. So, hindi na tayo droopy-droopy. Okay? So, that's a prevention. So, will be this one, yung ating handle. So, apply lang directly on the skin part. Okay po. Then, we just push on the bottom here. It's very easy technique. Okay. So, very comfortable si Ma'am Susan. So, we can just do on top here on the forehead area. Ayan. So, that's 2 shots already. You can hear those parang freaking sound, Ma'am Susan. You're okay? How is it?
Okay lang, hindi naman masakit.
Yes. So, yan. Yung sinasabi nilang tolerable, painless technique. Okay.
So, Doc, para ka lang po in ultrasound? Like, yung baby
Yeah.
ultrasound?
The imaging technique they make use sa ultrasound, yon. Ito rin yung technology that we use for that. Although this is a micro-focus ultrasound waves or high-intensity focus ultrasound. We just focus talaga sa certain areas that we need to target. Okay. In terms of the results, when do you see results for this one? Ito po yung hinihintay natin, number of weeks, a month or 2 or 3, nakikita natin na nagli-lift yung kanyang skin. But right now, mararamdaman ni Ma'am Susan na nagkakaroon na ng tightening and lifting ng ating skin from inside out. Kasi the beautiful thing with this, it stimulates your collagen formation. So, nagkakaroon ka ng development within the skin nung mga fibers that will hold the skin, make it tighter, firmer, and lifted. So, naiiwasan yung pagkasag, droopy, di ba? So, maintain yung pagka-young looking eyes natin.
Ito, ano pong pinagkaiba niya sa Botox?
Okay, Botox is an injectable. It's one of our injectables here. We treat lines and wrinkles. Yun pa rin ang primary treatment for fine lines and wrinkles. That's the Botox. Okay? So, yun, injection yun. So, it's minimally invasive. Kung ang target mo talaga, wrinkles, then you go with the Botox. Okay? So, actually, with Ma'am Susan, we can do combination. We can do Botox for her also on the crow's feet, below the eyes, para ma-lessen, ma-minimize yung kanyang mga wrinkles dito. And then also on the glabellar line. So, we have yung tinatawag nilang onset, right?
Yung mga lagi nakakunot yung noo.
Yes, we treat that with the Botox also. Okay. Now, another treatment that we can also make use of, yung lasers. We can also do combination laser. Okay, we can remove now and we can transfer here. So there's what we call laser also for the sagginess of the skin, the laxity on the skin around the eye. We can combine it with CO2 fractional laser. Kasi yon, meron siyang thermal damage into the inner layer ng skin. Nag-create ka rin ng mga collagens, ng mga protein fibers to tighten, to firm the skin from inside out also. So we can do a combination therapy kay ma'am. Actually, we can laser also or do CO2 fractional laser around the eye area para lalong maging tight, maging firm, at saka mag-smoothen yung surface ng skin. So it has a skin resurfacing and collagen formation at the same time. Diba?
All of that without stitches.
Correct. Non-surgical, no stitches, no sutures, no cuts, no incisions, no risk for scars. Okay. So we may do on the other side. Yan. So yun, CO2 fractional laser. Another one, we also have the IPL rejuvenation. So we can also do mga ka-CSA combination na IPL, intense pulse light, for also rejuvenating the skin. So while we're doing the Ultherapy, okay, dito pa lang po, meron na tayong na-appreciate na result for our client. So Ma'am Susan, you may want to see the result in a month, in a 2 or 3 months. Nakikita mo pang nag-i-improve, bumabata ka pa as each day will pass by.
Good, Doc.
Exciting!
Yes,
right.
of course.
Imagine na, wala na pong mga surgery, walang operasyon. No need for general anesthesia, right? That's a very good technique. So also, we combine Botox with dermal fillers. So dermal fillers is also good for hydrating the skin. Diba, as we age, nawawala na yung water holding capacity of the skin. So you may also combine with dermal fillers. So the injectables, Botox, fillers, yan ang ating treatment. Another thing pala, we also have here at CSA the so-called ultraviolet threads. Okay, isa ring interesting topic, but we'll also deal on that in our next episodes. So these are just fine strands that we can insert beneath the skin, okay? Leave it there, and then you also have collagen formation. So
Ito,
many techniques that we can do.
Doc, medically speaking, pwede
Yes,
rin ba
ma'am.
po yan sa mga nagka-thyroid?
Okay, those cases na merong mga medical conditions, as much as possible, kailangan ma-correct muna ang any form of abnormalities like yung may mga thyroid disorders, yung mga may thyrotoxicosis or hypothyroidism. We have to correct them first. Siyempre, may mga contraindications. Kung meron po tayong mga like uncontrolled hypertension, uncontrolled diabetes, or cardiac arrhythmia, or you are on a medication or any form of treatment. So, i-rest muna natin. Pag controlled na po ang mga medical conditions, then we can do corrections of that.
Oh, so it's very safe compared to
Yes.
stitches talaga.
Right. So, another concern kasi, di ba, yung may mga nagkaroon ng mga thyroid abnormalities, remember yung mga may thyrotoxicosis, meron sila yung protrusion ng eyeballs din nila, tapos yung eyelid area nila medyo ano rin, yung tawag dito, may test na kami tinatawag doon yung lid lagging. Yung hypothyroidism naman, yon napaka-puffy din ng mga eyes nun. So, they have to treat muna any medical condition before we subject them to aesthetic procedures like this. Oh.
So wala palang forever.
Yes, that's everything must be maintained. Okay, so if we control already the aging process, what we can do is maintain the young look of the skin via this treatment. So we already have about 26 shots for Ma'am Susan. So okay? Okay po. So these are techniques that CSA is offering. So for those with these concerns of sagginess ng upper eyelid or drooping or yung mga hooded eyes, you can do this kind of procedure, the so-called Ultherapy, mga ka-CSA. Yan po. You may want to invite our televiewers, Miss Vanessa.
Hi mga ka-CSA, my name is Vanessa and I'm inviting you here at CSA Derm Center at Mabalacat, Angeles City near Tao Pure Gold.
Okay. So, ang ating mga ka-CSA, if you have any questions, comments, suggestions, you may email me at csaskinclinic@yahoo.com. Our contact numbers are 045-331-1117 or 0906-478-4981. Again po, matatagpuan kami dito sa second floor ng Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat City, Pampanga. So, ang ating mga ka-CSA, naway mayroon po kayong natutunan sa aming episode on the sagginess of the upper eyelids. Okay? So, again, when it comes to your skincare, you may trust the CSA Certified Skin Authority. Thank you very much.